Okay, this is a 360 of the area. My name is Ashante Brown. It's SHANTAY BROWN. This is my Seneca ID. Currently, we are at the emergency room. I have a 17-year-old male patient who reported feeling dizzy, a bit nauseous. Also reported having a headache and feeling weak. Currently, the patient blood pressure is 115/70, which is normal. The patient has a temperature of 39.7. The patient's heart rate is 115 beats per minute, which is tachycardic. The patient respiratory rate is 22 breaths per minute, which is a bit high. So what I'm going to do is continue to monitor the patient's vitals, check the patient's blood glucose because the patient is a type 1 diabetic. I'm also going to monitor the patient's level of consciousness, and we're going to go now meet the patient. Hi there, how are you?
I'm well.
Okay. Can I please have your name first and last?
Yeah, India Rollo,
Okay, good. And can you please tell me what date it is today?
February 15th.
Thank you. And where we are now?
St. Catharines.
Okay. So do you have any form of allergies?
Yes, penicillin.
Okay. And do you take any medication?
Yes, insulin.
All right. Okay. Thank you. So you stated you have a headache?
Yes, 1 day ago. Worsening today.
Okay. So it's when did it start?
A day ago.
Okay. Thank you. And what makes it worse? Like what makes your headache worse?
Movement and light.
Okay. What makes your headache better?
Falling asleep.
Okay. And could you describe your headache for me?
Throbbing.
Throbbing. Okay. Is there any specific region of your head that the headache is?
All over my head.
Okay. Does it radiate to another part of your body?
Does not spread. Just feels very fatigued, tired, and dizzy.
Okay. Okay. And could you rate the pain for me on a scale of 1 to 10? What would you rate your pain?
The worst, 8 out of 10.
Okay. All right. Thank you. And what time of day does this pain happen?
All the time.
All the time. All right. And did you take anything for the for the pain?
I tried to take Tylenol and Advil, but it didn't work.
Okay. What do you think is causing? What's your understanding of this pain?
I don't know. I just feel sick.
Okay. All right. So do you have any head injury? Any history of head injury?
No.
All right. Do you have a history of dizziness? Dizziness? Do you have dizziness?
Yes, I feel dizzy, but it is making me more nauseous.
Okay, thank you. And do you have difficulty speaking?
No.
Difficulty swallowing?
No.
All right. Do you have any numbness and tingling?
No.
All right. What about history of seizure?
No.
Tremors?
No.
Do you have a history of weakness?
No.
All right. When you breathe, do you feel any pain when you breathe?
No, but my chest hurts a little.
Do you have any shortness of breath?
No.
Do you have a cough?
Yes, I have a cough, but it's not too bad.
Is it productive? Like, do you see sputum?
No.
Okay. All right. So what we're going to do next is I'm going to do an assessment of your chest. I just need you to turn around and lift your shirt up. All right. So currently I noticed that the patient lip is blue, which is indicative of cyanosis. Also, the patient is alert and oriented by 3. She's able to tell us where she is, her name and the time and the date. Also, I noticed her breathing is easy, non-labored. I don't see any evidence of respiratory distress. The patient is not using any form of accessory muscles for breathing. So we're going to auscultate the patient back. Okay, whenever you feel my stethoscope move, just take a deep breath in and out for me, okay? Okay. Okay, deep breath in. Okay, deep breath in. Okay, deep breath in. Deep breath in. Okay, deep breath in. Out. Okay, in, out. Okay, in, out. In, out. Okay, deep breaths in, out. Breaths in, out. Deep breaths in, out. And deep breaths in, out. All right, so the patient lungs are clear. The upper lobes are clear, but the lower lungs, I hear a bit of bilateral crackles. All right, so I'm going to be testing your eyes now. Okay, so just keep your eyes open for me. All right. Now, can you raise your hand in the ear for me? All right, so the patient is able to keep eyes open. The patient is able to follow command, and the patient is responding appropriately to my questions. So I'm going to be shining the light into your eyes, okay? So the pupils appears to be equal and round. Let me see to light, okay? All right, now you're going to be looking at the pen, okay? Then look beyond the pen, then follow the pen this way. All right, so the patient's pupil is equal, round, reactive to light and accommodation. All right, so next I'm going to test your hand grips. Okay, and then now your foot grip. Just push on. All right, good. Okay, so the patient has good hand grip and good foot grip. I saw the patient walk in earlier, so the patient has good gait. I don't see any form of rigidity or stiffness within the patient. No form of muscle wasting. Just a little bit of, the patient has a little bit of tremor, but nothing that I am worried about. All right, so for an S-bar, so the situation is I have a 17-year-old male patient by the name of India Rollo, came to the hospital reporting of feeling ill, feeling dizzy, feeling nauseous, having a headache, and feeling a bit weak. Background on the patient has a type 1 diabetic, which is uncontrollable. The patient reported having a headache, which is a 8 out of 10, worsened by light. Also, the patient reported having a bit of chest pain when breathing. Also, patient said that they're feeling a bit nauseated and fatigued. For assessment, the patient lips are cyanotic, appears to be a bit agitated. The patient is a bit agitated. Upon auscultation, I heard that the patient has bilateral crackles in the lower part of the lungs. The upper is clear. The patient is alert and oriented by 3. For recommendation, I recommend that the physician come and see the patient and also provide us with medication to help the patient stay comfortable, some analgesics and also antipyretic. What I think is happening with the patient, there's some form of bacterial infection happening. Nursing assessment to continue is I'm going to monitor the patient vitals, provide fluids, provide warmth. I'm also going to provide the patient, check the patient's vitals. What I think the doctor is going to order is an ECG for the chest because of chest pain. The doctor may also order blood work to see what's happening. He may also order a CAT scan. He's going to provide us with medication